Welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. It's Heart Health Month, so we'll explore what you should be doing for a healthy heart. But before we get started, let's take a look at what's coming up on the show. We bust a myth of good facts versus bad facts, and we show you why Carrot Eye Center's on the cutting edge of vision. Plus, weight loss answers for those who've been struggling to drop those extra pounds. All that and more on this episode of Your Health. Heart disease is a leading cause of death here in the U.S., and since February is Heart Health Month, we thought we'd get some practical advice on ways to keep your heart healthy. Joining us now is Dr. Maulik Shah. Dr. Shah, thank you so much for being with us.
Thank you so much for having me this morning. I appreciate it.
First off, are you finding that people are neglecting their heart health during the pandemic?
Yes, unfortunately we are. Obviously, it's been a stressful time for everyone. In fact, there have been some studies that have suggested that about 40% of people have not gone in to see their doctors for their preventive wellness stuff. And about 20% of people, even when they're having something really acutely wrong, like having chest pain, are avoiding going to the hospital or to the emergency room. And the problem with that is that sometimes it can have some devastating consequences in that if you don't seek out medical attention immediately, if you're having something like a heart attack, then the impact can be long lasting and permanent.
Dr. Shah, what do you say to people who may be neglecting their heart health right now?
I know all of us are apprehensive in this era of COVID and the infections that are going on to go to a hospital or a doctor's office. But the reality is that there's a lot of options. First of all, most physician offices are taking great precautions to make sure that they're a COVID-safe environment. And then equally important, I think this COVID world has actually pushed us to become more avant-garde with advanced technologies such as telehealth to make sure that we can actually see patients and connect with them even without being in the same office room with them. And with telehealth, we're able to at least connect with the patient and make sure that they're not having any symptoms, that they don't need significant tests, and that we can also make sure if there are any adjustments that need to be made in their medications, we can do that while seeing them sort of virtually.
Now, let's talk about overall heart health. What are some things we should be doing to prevent heart disease?
Well, what we've learned is that more than 50% of all heart disease could have been prevented by just being proactive about your health. And what that means is everyone needs to know their numbers. So everyone needs to focus on their blood pressure, their cholesterol, their sugar levels, their waist size. And just by doing those things, you can really prevent a lot of heart disease. So for instance, high blood pressure. For every 20 points, your number is above 120, your lifetime risk for having a stroke or a heart attack goes up by about 33%, or risk for dying goes up by about 20%. So even if you could impact that small number, that blood pressure number, you can really prevent heart disease in a big way. And similar things are found by lowering your cholesterol, lowering your blood sugars, figuring out your waist circumference, and making sure your pant size isn't getting too big. If you know those simple things, those simple numbers, and focus on that, you can really prevent a lot of the devastating consequences of heart disease.
Dr. Shah, are women equally at risk for heart disease?
Great question. I think all of us have sort of a vision of sort of the Hollywood heart attack. A guy who's in his 50s or 60s, a little bit overweight, who comes in clutching his chest. And that's what we've always been thinking about as being somebody who has heart disease. But the reality is that sometimes it's not that person. And unfortunately, heart disease does impact women just as much as men. In fact, heart disease is the number one killer of women in the United States in most years. And the number of people who are women in the United States who die of heart disease is equal to or more than all forms of cancer combined for women, including breast cancer. So it's a big deal, and it's really important that we push our wives, our daughters, and our moms to get treated and get evaluated sooner rather than later so that we avoid any long-lasting consequences of heart disease.
Now, Dr. Shah, are there any indicators that someone may have heart issues?
Yes. So, when somebody comes in and we're suspicious about heart disease, there's, again, two things that we look at. One is their risk profile, meaning, hey, do they have high blood pressure? Do they have high cholesterol? Are they diabetic? Are they not exercising? So we look at that risk profile and we say, hey, this person does have a lot of risk. My suspicion is even higher for them potentially having heart disease. And then the second part is that when we think about people with symptoms. So again, the same things that worry us the most for when people are presenting in the emergency room are the same thing we think about in our offices, meaning if people are having chest tightness, shortness of breath with exertion, shortness of breath, exertional fatigue, those are the things that we think about really that could potentially be a sign that somebody is having heart disease or is at risk of having sort of occult heart disease.
Dr. Shaw, thank you so much for being with us. This is such great advice. If you'd like more information, head over to Honor Health's website. This past year has been difficult and it's taken a toll on our mental health. The experts at Focus Family Services have advice on when you should seek help and get a mental health checkup.
There are many signs that we notice within ourselves that we know that we can seek help. Your body tells you that something's not right. Whether it's you're sleeping and you prefer to just lay under a pillow and a blanket all day, and that's not your norm. I think if it's anything that's out of your normal day-to-day routine, it's something that you might want to pay attention to and then say, hey, maybe I should call. And maybe it would be good for me to just check in.
This year has been tough. Across the board. With the pandemic, the health problems of the pandemic have been brutal. People have lost their lives, people have been incredibly sick. Secondary to that, and I've said this from the beginning, there are so many issues related to COVID-19 that aren't related to medical. Depression, anxiety, mental health, suicidality, substance abuse, domestic violence. All of those things, we've been providing those services before we knew what COVID was.
Focus Family Services is about focusing on family. We focus on the individual and their mental health. We focus on restoring individuals to their optimal functioning.
We do outpatient group counseling for substance abuse, anger management, domestic violence. We have a mindfulness skills group that I do. And then we also provide individual counseling, family counseling, in-home counseling, as well as psychosocial rehabilitation services and vocational rehab services. Every year we're supposed to have an annual physical, and I think that it should be the absolute same for mental health. You know, the way the mind and the body are connected is really, really important, and sometimes it will show up physically when it's actually much more of an emotional or a mental problem. So I think getting a checkup, like a mental health checkup, is really, really important.
We are a small behavioral health agency. We pride ourselves in providing the best individualized, personalized care to every member that walks through the door. Larger agencies sometimes struggle with that simply because of their size. With our size and the services we provide, we can make sure that everyone that comes in feels comfortable, they feel like they're part of their treatment team and they're an integral part of their treatment team, and they feel a sense of belonging with everyone here that they work with. Everyone that's coming in is wearing a mask. All of our staff, when interacting with our members, wearing masks. Everyone that's coming in, their temperature is checked when they walk through the door. All of our members know, and this is reiterated frequently, if you're sick, if you're symptomatic, we can provide telehealth services. We can provide those services via the computer, via the phone. We don't want people here putting themselves or anyone else in harm's way. For anyone that has any questions, our website is www.focusedfamilyaz.com. All of our contact information is there, and our phone number is 602-253-6259.
The American Heart Association says being physically active is one of the most important things you can do to prevent heart disease. They suggest getting at least 150 minutes a week. 30 minutes a day, 5 times a week is an easy goal to remember. So get up and get moving. Stick around, we have more to come on your health. The Stronger Together campaign is helping Kansas residents. And Better Vision with Carrot Eye Center. In Kansas, they're helping their community cope with the impacts of the pandemic with their Stronger Together campaign. Let's take a look.
Stronger Together is a new program that's a partnership between At the state level, the Kansas Department for Aging and Disability Services and the Kansas Division of Emergency Management. And it's a crisis counseling program that's really designed to support individuals who may be struggling, really with the results of the pandemic, whether they've been impacted directly by a COVID health crisis, the loss of someone they love, or just the social isolation that really so many of us are experiencing right now. People can access crisis counseling remotely. They can access it through certain community mental health centers. And then we have lots of educational material and online support. It's available to everyone. It's really just designed to help the citizens of Kansas cope with the pandemic. I think sometimes individuals might be sitting here thinking, gosh, I haven't contracted COVID. I haven't had a family member who's had COVID. I still have a job. I haven't lost my job, but that doesn't mean that just the weight of this pandemic isn't impacting that individual. And we know that the impact of, just behavioral health challenges, depression, anxiety, the impact that can have on one's overall health and well-being, on one's ability to connect with one's family and friends, all those things. So it's really important to have a resource that's available to everyone, because we've all been impacted by this, including those very, very directly impacted by the virus, and including those directly impacted because maybe they've lost their economic well-being, but also just everyone else as we're living really together through this pandemic. The goal is really to kind of connect folks with ways that meet their circumstance. Issues around, if there are issues around family and children, maybe domestic issues, and also to be really culturally competent in terms of what individuals might need from a cultural perspective. If you're struggling, if you're feeling isolated, if you're feeling lonely, maybe feeling a bit depressed, that is a really, really common feeling right now. And these resources are there for you. And we just encourage you to go to ksstrongertogether.org and reach out. I think the mental health and well-being of all Kansas citizens is really our highest priority. And just make that call, engage in that chat, just connect, and you'll feel better. And I think that we'll see an impact as we really work to address hard the mental health side of this pandemic.
At Carrot Eye Center, they're on the cutting edge of vision restoration, and they're now offering telemedicine for your convenience.
We really care about your safety when you come in to see us at Carrot Eye Center. So what we've done, we've instituted, pretty much the usual things that you're experiencing when you go anywhere. Temperature checks, we're doing a questionnaire, but on top of that, we've totally revamped our scheduling. So you're not coming in when a whole bunch of other people are coming in. So you'll largely have the clinic to yourself. We have barriers surrounding you when you're in testing, all the equipment's wiped down. Dr. Herring and I are on masks, and so are our entire staff. We really care about your safety.
One of the options that we do offer to our patients is a telemedicine visit, where they can come into our office for a diagnostic visit, and then in the comfort of their own home, talk with either Matt or myself to go through the results of that visit.
When you come in for a telemedicine exam, we want you to think of it exactly the same way as you would coming in for any normal exam. However, we've split it into two parts. So the first part, you'll come in and get all your diagnostic tests. We're going to examine your retina. We're going to look at your cornea. We're going to look at your lens. We're going to test you for glasses and contacts. We're going to do a video exam of your eye. Then you can go home. Go home to the comfort of your own home. You can be at work, wherever's convenient for you, and we'll set up the second part of that exam. That's a personal consultation with Dr. Herring or myself.
Hi, Rachel. I'm Dr. Herring. How are you doing?
Good.
Good. Well, thanks for joining us today. Is this your first time doing a telemedicine visit?
It is, yes.
Awesome. Well, I'll talk you through everything. This will be easy, and I think it's actually going to be kind of fun. So first thing I'm going to do is I'm going to share my screen with you so you can see exactly what I'm looking at, okay?
We want you to feel like you're with us. We want you to see what we see, and we want to be able to give you all the diagnostics necessary for you to feel like, and for us to feel like, we got you exactly what you need.
Okay, so the first image we're looking at here is the back of your right eye. What I'm circling with my cursor here is your optic nerve. So at Carrot Eye Center, we take safety very seriously. We've done everything in our power to ensure that you have a safe visit. More importantly, a visit where all of your diagnostic and medical questions are answered. Everything looks absolutely perfect. I don't think that there's any corrective action we need to take for you, other than maybe getting you into a new pair of glasses or contacts, or if you're interested, certainly scheduling a refractive evaluation so that we can look and see if you're a better candidate for LASIK or SMILE.
We want you to feel safe when you come to see us, bottom line. But we also want you to feel taken care of. We take care of people, not just eyeballs. We want to make sure that you are getting the same quality, the same consistency with our expectations at Carrot Eye Center. So when you come for a telemedicine exam, you're getting the very best in a safe, effective, and convenient manner for you. We're really excited about this. We can't wait to see you.
If you'd like to start juicing for heart health, try adding Beets. Their vitamin B folate content is excellent for lowering homocysteine levels in the blood, which prevents arteries from hardening. Here's what's coming up on the show. How your gut may be impacting your ability to drop those extra pounds. And is all fat bad for you? We bust the good fat versus bad fat myth.
Your health is brought to you by Excellent. Take just 2 Excellent tablets each day to support healthy blood sugar levels the easy way. Order today at Excellent.com or Amazon.
If weight loss is a battle for you, then the experts at Platinum Wellness may have the answers to help transform your body.
Hi, I'm Dr. Anthony Infantino from Platinum Wellness. The reason I got involved in health and wellness in the first place is really watching my grandmother succumb to the effects of diabetes over a long period of time. Our whole family thought, well, we don't want that to happen to us, so let's start dieting and exercise. And to be honest, every time we did it, we might lose 10 pounds and gain back 12. And we'd lose 10 and gain 12. And that was really frustrating. Like, why are some people able to lose weight, keep it off, and never worry about it? Other people struggle their whole lives. And I figured that out. Typically, they've tried everything from reducing calories to increasing exercise to like counting points and phentermine and even bypass surgeries. They're frustrated because the problem isn't the program. The problem is the fact that their bodies are out of balance internally. And when your body's out of balance internally, hormones get off, your metabolism slows down. And what that really boils down to are a couple main systems, right? Our gut, our liver, our lymphatic system. Those are the big players in getting your body fired up to burn fat, to get healthy, to feel amazing. So like, for instance, the gut. What most people don't realize is inside your gut, you have a bunch of healthy bacteria. Those bacteria do everything from digest food to make B vitamins, to give us energy. They lower blood pressure, cholesterol, blood sugar. They make things like serotonin, which keeps us upbeat and happy and healthy and energized. Serotonin is converted into melatonin, helps you sleep. So most people's guts, though, those healthy bacteria have been wiped out. They've been wiped out from things like antibiotics in our food, or the round of antibiotics you had for dental work 20 years ago. And when those guys die off, our B vitamins go down, so our energy level goes down, our mental clarity, our enthusiasm for life goes down. So that's why people find themselves stuck. They're like, I don't even have the energy to try to go on some kind of diet again. And to that person, what I simply say is, look, let's not focus on low-cal and diet. Let's just focus on getting you as clean, balanced, and internally as possible, because then hormones naturally reboot. Your metabolism fires back up, right? Because let's say your gut is out of balance that way. What ends up happening is all that stuff, like the average person, somewhere between 5 and 30 pounds of undigested fecal material in their gut. And when that sits in there, it leaks over to your liver. Your liver burns all the fat in your body, so if it's busy dealing with that, plus environmental toxins and makeup and shampoo and deodorant and toothpaste and Lysol and Windex, all those things get our livers pretty sluggish. If you're gonna burn 1 ounce of fat, it's because your liver's fired up and ready to go. So by cleansing the liver, by healing the gut, by rebooting the body naturally internally, people lose weight, they keep it off. More importantly though, they feel better. They have the energy to go out and do the things in life that they'd love to do. So I think the biggest mistake people make is they think, if I lose weight, I will get healthy. And it's just backwards. The reality is, if you really focus on getting healthy, clean, internally balanced, that's how you lose weight. And more importantly, that's how you keep it off and you get off this diet roller coaster of the ups and downs forever.
go anywhere. We have more to come on Your Health. We tell you the types of fats you should be incorporating to your meals.
Your Health is brought to you by Excellent. Take just 2 Excellent tablets each day to support healthy blood sugar levels the easy way. Order today at Excellent.com or Amazon.
Chance to talk with Dr. Schott about the myth that all fat is bad for you. He tells us whether that's true or false.
The answer is that fat is good and bad, and it depends really on how you prepare the fat, where the fat comes from, and what kind of fat it is. Let's start with what is good fat, because for many years we thought that all fat was bad. And the reality is that when we had a head-to-head study from the American Heart Association, at that time low-fat diet versus the Mediterranean diet, the results were so impressive that they actually had to stop the study in the middle of it because the people in the Mediterranean diet group had such great benefits for their heart, with less heart attacks, less strokes, lower blood pressure, lower cholesterol, and they were just doing so well that it was unethical to continue the study. And so what we learned from that and subsequent research is that there's good fats that we need actually. Fat is a critical part of heart health, brain health. Every cell in our body needs fat. The question is what kind of fat? And the best fat is actually plant-based fats that come from nuts and seeds, avocado, and then also followed by that is fatty fish, wild seafood, the healthy fat that comes in wild salmon, for example. Or omega-3 fish oil. Obviously, extra virgin olive oil is a plant-based fat that's also really good. Bad fat is actually processed fat. Fat that is like hydrogenated oils and other kind of ingredients of solid fats that are in processed foods. And also any fat, even the best extra virgin olive oil, if you cook it past the smoke point where it starts smoking, you actually damage the fat. And that damaged fat goes into our bloodstream and then it basically oxidizes and further damages our LDL cholesterol, causing inflammation, which eventually leads to the process of atherosclerosis and narrowing of our arteries that leads to heart attacks and strokes. So that's why the issue of fat is more complicated. Looking at what kind of fat is the most important question.
Thank you so much for joining us on Your Health. I'm Erica Cardenas. See you next time.